Okay, let's talk about the US healthcare system. It's a topic that affects every single one of us, but let's be honest, it can feel like a total maze, right? It's complex, it's confusing, so in this explainer, we're going to cut through some of that noise and try to make sense of it all. Let's dive in.
To kick things off, let's just start with a really blunt assessment from a TED Talk. One expert called the US healthcare system a more embarrassing disaster each year. Wow, those are some strong words, right? But they really capture a frustration that so many people feel, and they get us right to the heart of the debate we're about to unpack. And here's where things get really interesting. This chart, it shows the central paradox of it all. Just look at the bar for the United States. It is towering over everyone else. We spend dramatically more money per person on healthcare than any other developed nation. Often it's twice as much. But, as we're about to find out, all that spending doesn't mean we're getting better health.
So that brings us right to our first section, the U.S. healthcare paradox. We're going to explore this really bizarre reality where the nation with the most advanced medical technology and the highest spending in the world still ranks last among developed nations in really important areas, like life expectancy. Why is that? Let's break it down.
So why are the costs just so incredibly high? Well, this slide gives us 5 huge reasons. First, just imagine the complexity of having over 1,000 different payers. That's insurance companies, government programs, you name it. The administrative cost is massive. Second, unlike most other countries, the US government is literally banned by law from negotiating drug prices. Third, you see those ads on TV all the time, right? Billions are spent advertising drugs directly to us, which drives up demand. Fourth, and this is a big one, there's a shocking lack of price transparency. And finally, the risk isn't shared across the whole population, which ends up making costs higher for everyone. It's really a perfect storm of inefficiency.
This analogy just illustrates that no free market point perfectly. I mean, imagine buying a TV without knowing the price, and then you get a bill for $16,000 weeks later. It sounds completely absurd, but that's honestly how healthcare billing often works. Hospitals don't have to tell you what they charge up front. So a C-section could be $5,000 at one hospital and $88,000 at another one right down the street, and you'd have no way of knowing beforehand. But the cost is only one part of the story. The quality of care you get can depend, heavily, on something as simple as your zip code. So in our next section, let's explore how the very structure of our neighborhoods can create these massive health disparities.
The core idea here is something called residential segregation. And this isn't just about people choosing to live in different neighborhoods. The research really frames it as a spatial manifestation of institutionalized discrimination. That's a technical way of saying it's a fundamental cause of unequal access to resources, to opportunities, and ultimately to healthcare.
So the crucial point is this kind of ripple effect. Segregation concentrates poverty. That then leads to neighborhoods with fewer doctors, pharmacies that are less stocked, and fewer healthy food options. The local safety net hospitals that serve these areas become financially strained. And the end result? Poor health outcomes from prevention all the way to treatment. Your address can literally shape your health. Now, faced with these huge challenges of cost and access, the U.S. attempted a massive overhaul. And this brings us to the Affordable Care Act, or the ACA. Let's decode this landmark piece of legislation and see what it was actually designed to do.
You can really break down the ACA into 3 simple ideas. First, what you can buy. It's standardized insurance plans to make sure they cover 10 essential benefits. So no more of those junk plans that don't cover you when you actually get sick. Second, how you buy it. This is the famous part. It made it illegal to deny coverage for pre-existing conditions, and it created marketplaces to shop for plans. And third, when you can buy it. It set up an annual open enrollment period where everyone is guaranteed approval.
So what was the impact? Well, this data from a projection for California is pretty telling. Without the law, more than 6.5 million people were expected to be uninsured. With the law, that number was projected to be cut by more than half, all the way down to 3.1 million, with millions gaining coverage through those new exchanges and expanded public programs. But, it wasn't a perfect solution. So who was still left out, even after the ACA? Well, the largest group, at 40%, were undocumented residents who were excluded from the law's provisions. Others just chose not to buy insurance despite the mandate, or they were exempt. This really highlights the gaps that still remained in the system. And this drive to close the gaps, to cover everyone, that brings us to a much broader global goal that really animates healthcare debates all around the world, the pursuit of universal health coverage.
So what does universal health coverage actually mean? Well, according to World Health Organization, it's about making sure everyone gets the health services they need, everything from prevention to treatment, without suffering financial hardship to pay for them. It's a goal that every single member state of the WHO has actually committed to.
In this image, it really brings it all home. Beyond all the policy papers and the political debates, this is what it's about: connecting people and communities with the care they need to live healthy, productive lives. It's a fundamentally human goal.
But the stakes here are just incredibly high. Globally, an estimated 150 million people suffer financial catastrophe every single year simply because they have to pay for health services out of pocket. That's 150 million families pushed into poverty just by an unexpected illness or injury.
And that leaves us with the fundamental question, doesn't it? The goal of getting quality care to everyone without bankrupting them seems pretty clear. But for a country like the United States, with the most expensive system and some of the best medical tools on the planet, the path to actually achieving that goal, well, that remains one of our greatest national challenges.